There are several different tests that you can do to look at disc pathologies, particularly in the lumbar spine. And some of them are really good and some of them maybe aren't quite as solid, but we're gonna go over some of them just so that way you guys can understand. One thing I do want to point out is the textbook and a lot of other books talk about radiculopathy as if it is an actual diagnosis. I do not want you guys to get in that mindset because radiculopathy is kind of like a huge blanket term that just means you got nerves that are mad. And so when we're talking about disc stuff, it's going to be very specific to the discs being irritated or we'll just use the blanket term herniated, but also we should know that there's prolapse and extrusion and sequestration and all of those. But when we're doing these tests, we don't know exactly what they are. So we'll generally call them a herniated or injured intervertebral disc that has material that's pushing on one or multiple nerve roots as they're coming out. One of the very best tests that has the best sensitivity and specificity is the centralization and peripheralization test. And so what you would do is ask them to go into a forward bending position repetitively. So they need to do it 5 to 20 times, and they would just bend forward and stand back up, doing this in a nice controlled thing, minimum 5 times up to 20 times as they're doing this. And if you think about the mechanism of injury, typically we have disc injuries when we bend forward because we're pushing all that disc material posteriorly. So this should actually cause them to have pain because it's going to be pushing all of that disc material backwards. So they're going to complain of a change in the pain that they are experiencing. Then if this doesn't cause any problems for them, or even if it does, then you would want to turn it around and have them do a centralization where put their hands kind of on their low back or on their hips and then have them come into extension and stand back up. And again, if all of that disc pathology is already posterior, this might hurt in the beginning, but the more they do it, the better it's going to feel because it's going to be pushing that disc material back anteriorly, which is where it's supposed to be, so the entire nucleus pulposus is all in one area. So you again would have them do it about 5 to up to 20 times, and you're looking for changes of pain. It's either going to make it feel better or worse, either one of these. And in truth, I often start with the extension first, because if it's not already hurting, we're going to see how this is, and then have them do flexion to get it kind of mad. If we do flexion first and push it all out the back, for sure the extension is really going to hurt. So then after that, we're going to have the vulnerability in the neutral zone. And this one is a pretty easy test. You're not doing repetitions of it. You're just asking them to go in certain positions. One of them can be in side bending. So you would just ask them to lean towards or away from the side that they're already experiencing pain and see if it exacerbates their symptoms. So this could hurt her leaning towards it because she'd be bringing all of those facets and the vertebral body together and pinching the disc material, or it could relieve it if the pain is on, if the impingement is on the opposite side. We can also have them do it in flexion, where she would just again come straight down, and you can have them do side bending with it, or you could just actually have them come straight down into flexion, and they don't even have to come that far. They can even just come a little bit into flexion. And then the last one is asking them to come a little bit into extension as they do that same test. Again, it's not a repetitive thing. It would just be a one-time move, but they keep their arms at the sides when they do this. The last test, that is actually a pretty good test, is going to be our extension loss test. And this is one of the most easy tests for our patients to do. Well, maybe not the patients, but for the clinicians to do. And all they're gonna do is you're gonna tell them to put their hands kind of about shoulder height, and then ask them to use their hands and their arms to press themselves up into an extended position. And you're gonna ask them to go as high as they can. If people stop really early, that's gonna be a sign, and they'd be reporting pain down here, that potentially they have disc pathology. If they can push themselves all the way up and it doesn't feel bad, their chances of having disc pathology are very, very minimal. This, again, especially if they have a lot of that disc material protruding out the backside, would hurt. Now, that being said, and this is skipping over into the rehab, this is a position that you would want to put them in and have them hold it sustained if they do have a disc issue, because again, that's going to allow for that centralization of the disc material, and it's going to remove a lot of their complaints over time. But again, it has to be sustained.